बिस्मिल्लाहिर्रहमानिर्रहीम। इय्याका नअबुदु व इय्याका नस्तईन। अल्लाहुम्मा सल्लि अला मुहम्मदिन व अला आलि मुहम्मदिन व बारिक सल्लिम व सल्लि अलैहि। Dear colleagues, I am Dr. Sultan Ayub, working as a radiologist, and this is a male child, almost 4.5 year age, with history of pain in the lower abdomen for the last 7 days. Now I am using the high frequency linear probe uh, to see the lower abdomen. This is the urinary bladder that is having little but debris, and this is the left iliac fossa showing the small bowel loops. And now I am going to toward the right iliac fossa, and this is the distal ileum which is present in the right iliac fossa and the pelvic region. And now gradually I am going towards the right iliac fossa, and here we can appreciate this mass-like structure which is significantly hypoechoic, and here we can appreciate the few pockets of fluid within this structure. And this structure, if we closely observe, this is the small bowel loop, and this is the small bowel loop, mean distal ileum, that is surrounding this rounded mass-like structure. And now we are going to see the origin of this structure. Gradually, this is the distal area of this structure, and now I'm going further towards the right side to see its origin. Here we can appreciate this is the distal ileum, which is edematous. This is also the distal ileum, and these linear structures which are present within the wall of the distal ileum is the fold, small bowel fold, valvulae conniventes, we call it. And look at this. These are also edematous valvulae conniventes. When the bowel loop become edematous, these mucosal fold become prominent. So, and now look here. This is the mesh-like structure, and this is the proximal end. Here the diameter is increased significantly. Look at here. And when we move proximally, here we can appreciate the diameter is decreased, and this one is originating from this area. So this is the distal ileum, and it is originating from this area at the right iliac fossa region. And if further go toward the subhepatic region, we can appreciate the small bowel loops in ileum. The edematous loops are present here, and this is the lower pole of the liver. And where is the large bowel, we can appreciate this is the large bowel which is compressed, this one gas filled by this edematous small bowel. This one is the gas filled. So now I'm again going towards the mesh-like structure. We can appreciate. Now I am going to trace it the distal end. Look at here. This is the increased diameter, and this becomes the distal end. And this is surrounded by this whole structure is surrounded by this small bubble. Distal ileum, we can say loop of the distal ileum. And this is the distal end, which is blind-ended. So what we can say, this is a blind-ended structure which is projecting within the distal ileum, and so we can say, I can say it, this is the basically appendix which has been surrounded by the distal ileum. So what happened, I can say that this child was having appendicitis and the 7 days before. Then he was treated, but the process, inflammatory process, further once worsened in spite of the treatment. So this he was given medical treatment, so it worsened, and then appendix become like this, and then it was surrounded by the, or it projected into the distal ileum. So look at the shape of the appendix. It is significant hypoechoic, and we can't appreciate the lumen of this appendix, and its diameter is very much increased. I can measure it. It is almost 19.4 millimeters. So it is significantly increased. It is like the dilated small bowel. Its diameter is significantly increased. So what happened, in my opinion, the appendicitis was there 7 days before. Then due to the medical treatment failure, this appendicitis worsened. Then it invaginated or surrounded by the distal ileum, which completely surround this appendix. Now I am going to use the color. Look at here. This is the edematous loop of distal ileum, and look at the blood supply. This is the hyperemic blood flow. Otherwise, in the normal cut flow, we don't see such kind of hyperemic blood flow. So the inflammatory process is present surrounding the appendix. And look here, this is the vascularity is increased in the periphery, in the wall of the distal ileum, which is surrounded the appendix. So now I am going to see the vascularity of the appendix. When I closely observe to see the vascularity in the wall of, this is the wall of the appendix, this one. I am unable to see the vascularity within the wall of the appendix. It means that the blood supply to the appendix has been completely cut off. So I can now say that this is the gangrenous appendix which has adopted such shape. So this is the gangrenous appendix which has adopted the this shape, mass like hypoechoic with internal pockets of fluid and having no blood supply. So this was, I can say that this was the case of acute appendicitis that further worsens and then appendix become gangrenous. When appendix become gangrenous, this appendix invaginate or project into the distal ileum. So this invaginate or projected into the distal ileum, and the when it had been projected into the distal ileum, the blood supply going toward the distal ileum was compromised and finally cut off. And so here we can say that now here we can appreciate that this appendix is given the target sign, or we can say gut within the gut sign. So I can say now it gangrenous appendix has been invaginated into the distal ileum, giving the gut within the gut sign. I mean to say it is a case of intersusception. So the recipient is the distal ileum, which has hyperemic blood flow, and the donor, which has been invaginated into the distal ileum, is the gangrenous appendix, which has no blood supply. Look at here. This is coming into the gut loop. And these are the other loop of distal ileum which are surrounding this area. So what diagnosis I can say, in my opinion, is that this was the case of acute appendicitis, which complicated to gangrenous appendix, and further it complicated to intersusception. So this was all about the gangrenous appendicitis complicated to intersusception. This is the gangrenous appendix, and this is the edematous gut loop, distal ileum surrounding it. And one such a picture is present. This also appear as a mass. So further we can say it as a appendicular mass. So this was all about the disease process of the appendix. starting from the acute appendicitis to the gangrenous appendix to the interception and to the appendicular mass. Thank you very much.